Glad to have you with us today. My name is Megan Collier. I'm joining you from Texas Tech University's Health Sciences Center, their Marketing and Communications Department. We have got a very, very interesting topic to talk to you about today, something that we have all learned a lot about, maybe a crash course you might consider, public health. Joining us today is Dr. Jeff Dennis, an assistant professor in the Department of Public Health. Sir, thanks for being with us today. We appreciate your time. Can you kind of tell us a little bit more about yourself?
Absolutely. Thanks for having me.
Yeah.
So I am proud to say I am a West Texas native. I grew up in Borden County, graduated from Borden County High School, which is about an hour south of Lubbock, a very small rural community. And if people have heard of it, it's usually for their six-man football. So that's kind of the size we're talking about. But I did a master's in sociology at Texas Tech. And went on to the University of Colorado and got a PhD in population health and demography in the sociology department. So I study health disparities and health services research kind of across a broad spectrum. And I teach in our department. I teach communication and ethics in public health, and I also teach a class on social epidemiology. I also serve as the Applied Practice Experience Director for the department, which is the project that all of our students go out into the community and do some sort of a public health project. And it's sort of their real world experience, and so I help coordinate that. And personally, I've been married for almost 14 years this June. My wife, Heather, is a licensed professional counselor, so this is actually in our
nice. Yeah, that's a good partner to have right now, right?
So she's trying to figure that out, and with our 7-year-old and our 2-year-old, we're making all of that work here in our house. So that's a quick crash course in who I am, I think.
Well, let's take a deeper dive into public health. I think a lot of people don't really think about public health unless it's a situation like we find ourselves in now. It's something that's absolutely integral to our communities. Can you kind of explain what the role of public health is?
Absolutely. Public health, it's a really broad field, and something you hear a lot, among other things, is kind of as you alluded to, you don't think about public health except when it's not working. And so when your water isn't clean, your air isn't clean, your food supply has something wrong with it, then those are the things that public health generally tries to do, so we never have to think about them. The core functions of public health, as we usually define them, there's 3, which are assurance, assessment, and policy development. And I think the one right now we're thinking a lot about is assurance, which covers a lot of areas just in and of itself, but it's dealing with access. Do people know where to go? Do they have a place to go for healthcare? Is the public health and the healthcare workforce appropriately trained? Are people where they need to be? There's also a certain level of assessment in that. Certainly, this is so fast moving. We don't have time to plan a study for 6 months like we might with a research project, because we're having to make day-to-day decisions as a field. I don't want to pretend like I'm making any world-changing decisions, but public health is having to move very quickly right now. And then another big piece of assurance, I think, is the messaging and education. And I think we're seeing that as incredibly important right now. And as something I teach, I've really been fascinated to watch that. And just one example, I think, about looking on, I don't think it was mistakes in messaging, but I think people are so accustomed to short-term events like hurricanes and floods. They've seen on TV people going and stocking up on water and toilet paper and things like that. And we kind of had that mindset because basically none of us have lived through this kind of a lockdown, especially on this scale. And we're kind of catching up now with this messaging of saying you don't need to go buy 6 months worth of toilet paper and every hand sanitizer and every Clorox wipe you can find. That we're trying to keep our supply chains open. And I think that's just something we're learning as we go. But I think just the message you give people is such an important key part of public health. And then on down the line, the other 2 pieces of assessment and policy development, those will continue on. Certainly public health is going to, in conjunction with medicine and other sciences, study this topic for decades probably. I mean, this lockdown has just had such an enormous effect in every area of our life that I think we'll see a lot of follow-up from that. And then hopefully down the line, policies that maybe will help us avert having to deal with something like this down the line.
So I think too, a lot of, doctors and medical practitioners treat a person. Public health is really focused on the community. Is that a different way to approach messaging? I mean, obviously, and you've heard this a lot in this particular instance, right? We have to look away from self and more towards the whole, right?
Yeah, absolutely. That's what we do. And we, to say we treat populations, that's kind of how we try to help people understand the dynamic. But, obviously there's a lot more that goes into that. It's about giving people the opportunity to make good decisions to improve their health and stay healthy. And so, I think the way that our practitioners focus, they are doing work that is intended to help a lot of people, right? I mean, and I think one way that we hopefully can help is we can kind of be an intermediary between the clinical side and the other sciences, and to help, I think we bridge that gap hopefully in a lot of ways.
So one of the things that a lot of people in this area is that we're focused on a lot is rural healthcare, and the idea that maybe it's not going to spread as quickly because we're a rural demographic. Right. Is there any sort of truth to that? Is there something different we need to do because we are a more rural community than, say the urban communities like New Orleans and New York City, things like that?
Sure, I think that's a really important topic, and one that our public health department is the only MPH program between El Paso and Fort Worth. So we do see that we want to help train that population, improve that workforce, because rural health is, I think, sometimes forgotten just because there has been such a shift to an urban society in the United States. But I think the simple message is, if you live in a rural area or a rural community, smaller city, the CDC guidelines, the health department guidelines are still just as important. I think the thing that rural areas have in their favor certainly is low density, right? You're not going to, in your own community, interact with thousands of strangers every day on public transportation. You travel in your own car. It's easy to keep your distance, and I think that's a huge advantage. At the same time, we don't want to pretend like all is normal. I think we don't want to go that far, because we know that, among other things, I grew up 30 miles from a grocery store, and essentially similar for healthcare. And so you have to keep those things in mind, that your access is more limited. And we know there was a study last year that said across the nation, over 100 rural hospitals had closed in the last decade. And that's something that's really relevant to rural health, because those hospitals have such a vital function. I think close to 1 in 5 of those was in Texas. So we know a lot of those have closed, and that further impacts people's access and how far they have to go. So again, the simple answer is rural areas can take some pride and take some solace in the fact that it's easier to distance, but at the same time, they all have to eventually go somewhere for food and other necessary supplies. And so definitely can't let our guard down or just kind of pretend like this is not affecting us. So I think it's a delicate balance to walk that line.
When we're talking about public health too, going back to, these areas of the state that have these public health departments, you see in Lubbock and in Amarillo, some of the Texas Tech, professors and physicians are actually serving as health authorities for the city. How is that? How does that arrangement work exactly? And how does private influence public and public influence private as well?
Sure. From my experience and just what I know about the relationship with the health department and with our physicians, I think they've done a phenomenal job. Especially in coordinating messaging. I know I keep going back to messaging. It's certainly kind of the world I live in, but it's also what's going on really acutely around us right now. I think Dr. Cook and Ms. Catherine Wells, that's our health department director here in Lubbock, have done a great job of telling the different pieces. You know, when it comes to clinical advice, people want to hear from a medical doctor. But when they want to hear about all of the statistics about testing and about cases and contact tracing, and that's a big thing that our public health department does in the city, is track down where people have been, who might have been exposed. And I think they've done a really good job of balancing that out. From what I can tell, they've done a great job of following up on leads, and again, just coordinating the message. I think it's been a good effort. Again, everybody is learning as they go from this, but I think that just having the dialogue is the most important thing, and it's really encouraging to see that happening, that it's not 4 different entities giving you a different message that you have to then hope that people get the right one.
I think it's also great because it's combining minds, right? So different people are thinking different things, and you come together and you come up with one consistent thing. I think that's really awesome.
Absolutely.
I think what might be interesting, 4 years out, 6 years out, we're going to see maybe an increased interest in public health at the collegiate level, at the university level, because so many of us are looking at it right now and thinking, oh, wow, this is pretty interesting. Talk about what those certifications look like, and what it takes to come away with public health education.
Sure. We offer a number of options in our own department. Our Master of Public Health degree is about a 2-year degree. A person can get it 100% online, or they can get it at one of our campus locations. We have campuses in Lubbock and in Abilene. We have faculty in both locations, so you can take face-to-face classes. But by and large, it is the same degree. People get the same training. We are a generalist MPH, which means you essentially get exposed to all areas of public health, from epidemiology and environmental health, behavioral science, environment, biostatistics. You kind of get a good mix of everything, I think. And so, we specifically, we're a fairly new program. I think we're in about our 7th year with students. We've graduated maybe 100 students total with their Master of Public Health degree. And because of the area we serve, we recognize that a lot of people live in rural areas or in urban areas as well that aren't going to just move to Lubbock or Abilene. So online education is really important to us, and we do our best to serve those students in the same ways that we serve our face-to-face students. We also do offer a certificate program, which it's sort of for people who are interested in just getting some broad brushstrokes on what public health is. You take 15 hours or 5 classes, really hitting all of the core areas. And so that can be done in certainly a year's time or less. And then we have a couple of dual degrees. Actually, kind of a big part of our program is the MD and PH dual degree. So students who are getting their MD from TTUHSC can also, we have a system essentially where they can take MPH classes in some of their break times and come out with both degrees. Also, we have a Master of Public Administration MPH dual degree with Texas Tech that's offered in the Department of Political Science in collaboration with our department. So there's a lot of options, and we, as a generalist degree, we try to kind of tailor the people's experience to where they want to end up, and try to do our best to help place them wherever they see their education taking them.
Really interesting. That's so fascinating. So any grads out there that are, fighting the COVID outbreak on the front lines that you know about? Absolutely.
I know in the Lubbock Health Department, we have 3 alumni who are employed, and I've as much as I'd like to hear what they're doing right now, day to day, I also am not trying not to bother them because I know they're incredibly busy. In the Abilene-Taylor County Public Health District, we also have 3 current and former students working there. And then beyond that, certainly there are some that I'm probably not thinking of, but I know we have somebody working for Department of State Health Services here in Lubbock, somebody that works for VetStar, that is the health and mental health organization for veterans here in Lubbock. So again, everybody who works in health in any capacity is dealing with this in some way. And then again, we have quite a few people who graduated with their MD and PH who are in residency right now, and without a doubt, dealing with this very much on the front lines.
For sure. How are current students doing? We were talking before we went live that, you're transitioning to these online classes. This is a new world for everybody. How's everybody doing out there, you think?
Sure. That's a great question. I think as a program, the best thing we had going for us is the fact that everything was already implemented online. Even though people were taking face-to-face classes, we had the ability to shift them to online in a fairly seamless transition. So I feel very good about that. We're essentially running as normal. We'll take in new students in the summer and fall, and we have no intention of slowing anything down because of that. So we're very fortunate to have that online platform fully up and running. Certainly, though, on a case-by-case basis, we've tried to be as accommodating as possible. We're checking in with students. We've done a town hall over Zoom just to kind of find out what are their concerns, either broadly about COVID-19 or about the program in general of how we're handling things, and just try to keep an open line of communication. We absolutely do have some people who do have clinical duties, and they are working on the front lines or in other jobs that deal with this in a very firsthand manner. And so we're trying to accommodate them any way we can. And time will tell how long we have to do that, but our students are very important to us. And so I hope that we can continue on and help people progress through the program and move on to their respective careers or continue in their existing careers as needed.
I mean, I think that's an important thing, and that'll kind of wrap up our serious questions today. But what does a public health official look like? What do they do outside of an outbreak like this, and outside of a pandemic? What does the day-to-day look like?
Sure. So certainly within a health department, I don't want to speak for somebody I'm not a director of a health department, but I know that they do a lot around prevention. They're trying to get out messages about vaccination programs, about different types of healthy lifestyle related information, trying to just encourage at-risk populations to seek care or to otherwise address potentially risky health behaviors that try to, in the grand scheme, reduce smoking, reduce, especially driving while intoxicated, various substance use disorders, et cetera. So really working in a broad spectrum in that way. Within our own department, all of my colleagues have their respective specialties. I work in mental health and criminal justice quite a bit right now. So that's a lot of what I spend my time on, thinking about how do we deal with issues of mental illness, and specifically serious mental illness in incarcerated populations, and how can we best serve those individuals and keep our communities safe at the same time. So, it's a broad spectrum of assessing, but again, especially really focusing on prevention, and again, trying to be the field that does its job well enough that we never notice it, right? That we never have to worry about our water being clean or something else going wrong that could have otherwise been prevented.
I love that. So interesting. I'm so glad we got kind of a glimpse into public health today with you. That's so cool. So before we let you go, we're going to play a little lightning round. Okay. Right. You just have to give us your gut reaction to these answers. Okay. Okay. First question, easy one. Crunchy or smooth?
For peanut butter.
Or, I guess anything else, whatever.
Well, I'm living in a world of making peanut butter sandwiches very often. And
generally, I would say peanut butter, yes.
So I'm particularly partial to the things my kids will eat, so I'd have to say smooth. I definitely don't want to make a lunch that doesn't get eaten.
Good answer. Okay, second one. Does pineapple belong on a pizza?
I enjoy it. I am definitely not a diehard anti-pineapple person. I enjoy it.
There are those that are that way. Just okay. Favorite ice cream flavor?
I would have to say Americone Dream from Ben & Jerry's.
That's such an excellent one. Good choice. First concert you ever went to?
I think, aside from growing up seeing like country and western dances in my hometown, probably the first one I went to in Lubbock was Third Eye Blind and Eve 6 at the Fair Park Coliseum.
Wow, solid. That's an interesting show for sure. Okay,
Right.
last question.
Okay.
Are you binge watching anything right now that you find really enlightening or just great for, fodder?
Sure. Well, I just started the 3rd season of Ozark, which,
Okay.
it's a great show. It's a little dark for, what are kind of dark times, but it's definitely, it's kind of taking my attention away. The biggest thing I find is I watch TV and I see like people congregating and I'm like, oh man, I forgot what that was. I forgot what it was like to be around people. But yeah, that's what I've been doing.
I've been watching Homeland, and every time they shake hands, it sends me into like a frenzy, like, oh my gosh, where's the hand sanitizer?
Yes, I love that show.
All right, Jeff Dennis, thanks for being with us today, sir. We appreciate your time.
Thanks so much for your time. I appreciate it.